Hello students, good evening to this session. So today we would be discussing about the pros, cons, various career aspects of obstetrics and gynecology versus general surgery. So now the time has come where you are about to attend the counseling and you have to choose a specialty, and it's very important that you are aware of all the aspects of
Hello
this.
students, good evening to this.
So that you can take an informed decision about this. So I'm Dr. Gayathri, your ObGyn faculty at Dr. Tutorial. So about myself, I did my MBBS from Thrissur Medical College, that is in Kerala, and followed by post-graduation from AIMS Delhi. And I took an MRCUG degree as well. So I would be telling you about the obstetrics part. And we have our very esteemed faculty here, Dr. Rajamahendran sir. You all might be very well aware of sir. Sir is our surgery faculty. He's a practicing surgeon and a very renowned surgeon as well, who's the right person to guide you about surgery. So, and we both will be discussing about the pros, cons that you should know from both these fields.
Good evening, madam. Nice to have this session. I'm Dr. Rajamahendran, surgical faculty in Dr. Tutorials. I have completed my MS General Surgery from Chennai Kilpauk Medical College and MCH Gastro from Madras Medical College, Chennai. So this is a very interesting session, and we made purposefully comparison of two subjects because I cannot go and compare general surgery with the general medicine, because general surgery and general medicine are two different specialties that interest would have developed long back. But surgical specialty includes MS general surgery, OBG, ortho, all these things. So you might be having a dilemma whether to go for OBG or general surgery or orthopedic. So we'll be having discussion of surgery versus OBG today, and we will soon discuss surgery versus orthopedic later. So let me start with the question, madam. You would have taken this MS OBG, it's so huge amount of patient. After so long practice, now how do you feel about the specialty after joining and practicing this course?
Sir, this is a common question I think every practicing doctor gets. Are you happy with the specialty? And I feel that I'm really happy with the specialty, and whatever be the choice, I think it is like a marriage. After marriage, whatever it is, however you are, that's the best person for you, or that's the best specialty for you. Similar to that, I would say I love this field after entering to this field. Initially, I was a bit hesitant, especially after seeing the labor room, which is always somewhat of toxic. You can hear the loud screaming and everything that goes on in the labor room. But after entering the specialty, there were so many beautiful things I experienced. Especially, I was someone who was slightly more inclined towards the medical aspects or more towards the radiological aspects. But after entering into this field, I felt the beauty of the surgical aspects. And I don't think any branch gives you that flexibility where you can convert into more of a surgical field after joining. Like, for example, you take medicine, you have to stick up with medicine. You take surgery, you don't like surgery also, you have to stick up with surgery. But actually OBG was one field which helps you to specialize in the way that you want, and I felt it as incredibly rewarding. At the same time, it's challenging because you are dealing with two lives at the same time. You take the obstetric aspect and there are a lot of surgeries, and it was a wonderful journey till now, sir. I'm happy that I took ObGyn, and the decision was made at the last minutes, I would say, but still I'm so happy that I came into it. So what
Very
about
happy
you?
Thank you, madam. Very nice to hear about all the things, madam. Surgery, actually, when I took general surgery, I know this is going to be a long travel because we cannot settle like other specialties like general medicine or pediatrics. Those people settle very fast than compared to us, because my friend, when I completed MS surgery, he started his clinic with a pediatric and he started earning at that time itself 30 to 40 patients he'll start seeing at that time. But for me to see 20 to 30 patients, it took around 5 to 10 years. So to be frank, the surgical practice starts at 40 years. I will say surgical practice actively starts at 40 years. People come to you with a trust for surgery. Everything they come to you only after 40 years. Definitely, this should be had in your mind before selecting MS surgery, because you should be ready to fight for a long period. But once you touch that 40 years, your income and your practice, everything will be tripled or quadrupled compared to the other specialties. You will have no time. In fact, many times I used to feel it will be happy if I don't have surgery today. If I don't have OP today, I'll be happy. That much situation will be pushed on. As days go on, it will be like that. But very important is you have to love the field you have taken. So those who are taking general surgery, 100% you should have patient towards surgery. Don't take surgery because it is available at 8,000 rank or 10,000 rank and take surgery. Definitely you will not like surgery after as the days go on. So surgery should be taken with at least 70 to 80% interest you should have had in your MBBS period. That is most important, madam. That's what I feel. So, madam, can you tell
True,
the
sir.
pros in OBG, madam? What are the pros you felt in OBG field of? What are the pros you felt?
In contrast to the point that you told, that is one pro that I felt mainly about OBG. It gives you reward earlier. It's an end specialty. You can say that though it's not really an end specialty, it's like an end specialty. After 3 years of your degree, you are able to practice in the full on mode. You are going to practice well. You're going to earn well in the initial part itself. And the thing is that the surgeries, everything that you do is limited. Can become a master in it very easily. So again, you are taking care of two lives. So the reward, the satisfaction that you get after a delivery is too much. I would say this is one field where the patient walks away really happy when she is going from us. So that brings you a lot of satisfaction. Yes, there are night calls and all those things, but still the satisfaction that the field brings us really good, sir. And the main aspect which actually promoted me to take this was it was a 3 year branch. I did not want to go for a long branch where, as you told, settling might be after 40 years or something. That was one thing. OBG, after 3 years, you can get settled. I think for students also, if you are someone who has the dedication to invest in a lot of years for yourself, surgery might be the better fit for you. But if you are someone who is still undecided as of now, you are undecided whether you want to go for a super specialization, you are undecided whether you really like the medical part, the surgical part, radiology part of it, this is one specialty which beautifully combines all aspects of it. Because the medical side, you have a lot of medical disorders that you're going to deal with, like hypertension, diabetes, hypothyroidism, everything. And you have surgical aspects such as you have minimally invasive surgery. If you're really interested in surgery, you have gynae oncology, you have fetal medicine where you're going to deal with the radiology part. So this has a beautiful blend of all these other specialities. And if at all you find your liking to something else, because as of now, I know you would be saying that you like surgery, you like medicine, you like radiology. Unless you have the real taste of it, you never know. So after coming into OBG, this is one branch, I would say, which gives you that freedom to pick whatever you want, either radiology, infertility, or whatever. This gives you the freedom. That's the best part. And again, in the initial run, I think in all the aspects, in terms of settlement, in terms of payment, OBG might be rewarding in the earlier phase. But of course, surgery has the long-term benefits if you are going to invest your time for it, as sir was telling. So what do you think are the cons that you faced with this?
In surgery, actually, the pros, if I can tell, madam, this surgery is a vast field. To be frank, this is the one field which is growing much faster than any other field. So after surgery, there are around 15 to 20 super specialty available. So now surgery is becoming from a specialty to organ specialty now. So previously we used to tell MCH surgical gastroenterologist, we will be operating esophagus, stomach, colorectal, HBP, everything. But now it has gone to next level. Now MCH has gone to liver transplant separately. MCH hepatobiliary surgery has come. Now people are going for colorectal. So single team concept is coming up, and in depth the concept is growing. So it is going to be the fastest growing field, and you will be specializing in one specialty. So when you master that specialty, you are going to get cases from various places on that specialty only. That is why I told you it is a long settlement. The problem, constant surgery is also the same. It is going to take a long settlement. We have to finish MS. It will take 3 years. And after MS, there is a preparation year for 1 year for MCH. And that will take 3 years after MCH. And now, even after MCH, there are people going for fellowship training. So organ specific training. So even urologists go for some special training. So cardiothoracic surgeons, they go for some special training. So urology is fast growing. Gastrosurgery is also fast growing. Many special organ specializations coming now, madam. They are called as fellowships. After finishing MCH, we have to go for fellowship in transplant, fellowship in HBP. Like that, different specialties are going up. That is a cons, because it will take long time to complete and sit in one place for a practice. But until you sit, you will be having little difficulties. You'll be learning, and surgery is never ending for learning. We have to keep on learning. New things will be coming up. See, last 3 years back, for example, 5 years back, nobody knows about robotic surgery. Now everywhere it is robotics. So we have to update. See, you can see now at 45 years, I could not go and update on robotics because of the practice and other things. So maybe my practice will be having some future difficulties when more robotic surgeons start practicing around me. That is a constant surgery, madam, because we have to get updated to the developing knowledge. Otherwise, we will be lagging.
You should be always willing to study in this specialty.
Yes. We have to be ready to.
For all specialty, but especially true for surgery.
Madam, other specialties, it is ready to study, but here it is not study. Here we have to go and get trained ourselves. We have to keep on training skills. See, studying can be done from online, from somebody can teach and somebody from hearsay. But here we have to learn the skills, so we need to go for some place. We have to compromise our practice and go out for 6 months to 1 year to get something specially trained. So that is very difficult once your practice gets settled. That is a problem in surgery, we always feel. What are the future fellowships? And you told some fellowship in gynecology and all, madam, gyneconco. So what are the specialties available, madam, after OBG?
So we have MCH as sir. We have MCH Gynae Oncology, which is again 3 years where you specialize in oncology. You have MCH minimally invasive surgery, especially initially started in AIMS itself, where you specialize in all types of laparoscopy. You have again your fetal medicine, which is 2 to 3 year courses are available, in which you are going to do scans. You will find out early anomalies. You go for procedures such as amniocentesis, chorionic villus sampling, intrauterine transfusion. The scope is too many. And then you have infertility. Other less known branches include your urogynecology, which is again a very nice upcoming branch. There are limited doctors who are there practicing in urogynecology as well, sir.
Yes.
Yes. Apart from this, yes, apart from this, there is scope for MRCOG as well. So after your specialization, MRCOG is conducted in 3 parts. So after you finish that, you have good prospects where you can go to UK, practice there, and again complete your something known as CCT, completion of core training, and practice as a consultant in UK, or even go to other countries like UAE. Those options are there, sir.
Okay, madam. To be frank, I cannot complete in this short period as you completed for OBG, madam. Surgery, I have to take 10 minutes to tell what are the scopes available.
All periods.
That much specialties are available. That's why I'm telling. There are so many subspecializations. Starting from surgical gastro, urology, it goes on, madam. I cannot finish up in this small session. That I always tell some students used to ask, sir, can I take direct MCH neurosurgery, direct MCH 5 years cardiac? I will always tell them, don't take like that. You take general surgery, finish 3 years. 3 years, in the 3 years, you will know, like in your MBBS days, you had an idea, you had an interest towards surgery. Same way, in this 3 years of MS general surgery course, you will get an idea which specialty you are very much interested. Because during my MBBS days, I had a huge interest towards plastic surgery. But once I joined general surgery and started doing the work, I realized I had more passion towards surgical gastro, and I have to move towards surgical gastro, thinking about all the pros and cons in super specialty. Same way, the surgical super specialty, enormous scope is there, madam. They can go for MRCS, and after finishing MRCS, and they have a huge vacancy in Arab countries and also in UK, they can go join as a registrar and other things. But salary is also very good package in some countries for MRCS. But in India, though MRCS is not a recognized degree for practicing, or putting a board, we cannot put MRCS in our board. That is not accepted in India because we have to register every year. MRCS, we have to pay the royalty fees and we have to keep the name. Otherwise, the Royal College will tell you have to remove your name. So that is the problem in India. And also, we can only use MRCS as an attractive degree. People think, okay, he has completed a foreign degree. That is an advantage in India. Otherwise, no college gives you an assistant professor post because you have an MRCS, or no college is going to make you a professor because you have an MRCS. That is not going to help. So only here, the degree is going to help for MS or DNB, only going to help here for teaching post and all. So the future scope is excellent, madam. For MS general surgery, the future scope is excellent. How the student should be ready to withstand for long periods. Madam, yeah, madam. There is a question from one student, madam. There is a question from one student. Ma'am, how do you feel OBG for males? This is actually a very important question. So I'm seeing now students are messaging me, sir, can I take OBG? Male students are asking, can I take OBG? Because it's huge inhibition. Many places people have a hesitancy to come towards male gynecologists. What do you feel about it, madam? Do you have any male gynecologist?
Of course, when I was practicing AIMS, the same batch itself, we had 2 boys it was a total of 12 students. So 2 were males and they are practicing well settled. And let me start from the beginning. Usually students also ask me the same question. As a male, I think OBGs might not be a specialty for me. Maybe the main problem that the students have in mind is maybe the females will not prefer getting examined by a male. That is the main concern that is there. Maybe that holds true. I'm saying just maybe that holds true in your initial practice as an obstetrician. But let me tell you the ground scenario now, sir. Now we have very less practicing obstetricians as such. Most of the OB-GYNs are actually specializing into other field so as to decrease the night duty, so as to decrease the stressful hours. So obstetricians are coming, the number of obstetricians are coming down lower and lower. So at this point of time, if you are a skilled gynecologist, obstetrician, let it be a male or a female, if you are skilled, definitely patients are going to come. So initially, maybe the number might be a slightly less in your practice, but in the long run, once you build your practice, once you build your name, obstetrics will not be affected just because you are a male. As for other specialties in OBG itself, such as you are taking gynae, oncology, infertility, urogynecology, minimally invasive surgery, all these things, gender does not matter. It is, I would say, just like a surgeon. If a male can
Okay.
become a surgeon, it's equivalent to that, a male becoming a specialist in this field of OBG. It's just the same. Maybe in the initial aspects, there might be a bit of hesitation from female patients, but once you build the practice, it doesn't matter at all. I think the more of the barrier is there in your mind. My HOD, Sunesh sir, who was there in AIMS, he was a wonderful gynecologist. As his patient used to love to come to him. He was a very polite person. So I would say I'm just giving you one example of the many examples who are there. I think this trend has lately set in that male students are feeling OBG might not be the field for them. But I don't think that is true, sir. That's more in the mindset.
Okay.
Yes, sir. And
Okay,
just
sir.
one more point, sir. We have discussed so many positives about OBG. I would just like to give a fair idea about the cons that I felt as well, because students should know what are the cons as well.
Okay.
Something that you have to be prepared while you are taking OBG is that there are going to be night duties. If you are someone who says that, okay, I won't be available at night for delivery, that might not be the case. Even you are practicing in a private sector, even though you are a senior, you will have to go for deliveries. I know in some places you can slightly modify that, but night duties are a part and parcel of obstetrics. And also the duty hours are a bit hectic, the monitoring, everything. So you are going to have hectic hours during a residency. Sometimes you can have 24-hour to 36-hour duty. I think the same holds true for surgery as well. And after you complete the residency, the litigation part is a bit more. So how can you get around it? You have to be very perfect in your documentation. You have to do everything very meticulously, and you have to be very careful. You cannot have that light attitude which is going around you. You have to be very careful because you are dealing with two lives. So any complication that happens, the double impact are going to be there. I'm sure you might have read so many news in the newspapers and all. But the thing is, if you're really careful about it, if you love your patients, if you deal them very carefully, all those things, if you do properly, I'm sure that the litigation part is very, very less. It all depends on you, but you have to be aware of these aspects of obs and gyn as well. So, what do
Correct,
you
madam.
think, sir? How
Yeah,
is
madam, that's correct, madam.
in a surgery? Like, I think it is comparable with
Madam, actually, it's a myth. What we feel is, since we are surgical field, we always have a myth that we only have so much of medical legal issues. But to be frank, as surgeons, we are trained to get proper consent, other things. The more medical legal issues are more problematic, getting into trouble is by physicians only, because
Yes.
they think that is they think just, you see, most of the cases, beaten cases and all, if you see, not surgeons, they're not beaten people are not surgeons. People will not come and beat a surgeon because he has not operated a patient and the patient died. Most of the places, if you see, it is all because of a medical case who died in the casualty. Some suddenly brought here, he died because of heart attack. So that actually the medical legal issues and the fear of getting beaten by the public is more among the physicians, not among the surgeons or physicians, because we always get every concern, whatever we feel. We never, I see, if I for per month, madam, I will miss 50% of the cases because they won't come to me seeing my consent. Reading my consent, 50% of the patients will avoid me. They won't come to me. They will go to some other surgeon. I am very happy because I want to explain everything. Even 0.1% there is a complication, I will explain them. Only if they are ready, I will operate. Otherwise, they will never operate. Let them go to some other surgeon or somebody somewhere else. So that is the one thing we always been trained from our PG days. We have been trained to take video consent, audio consent. So medical legal issues, I can always say surgeons are at less risk compared to physicians or other specialty, including pediatricians. So because we are already documenting everything, whatever we do. So this is actually a myth. Many people think that medical legal issues will be into more trouble compared to other specialties. If you don't want medical legal issues, you only should take dermatology and radiology. Only two fields where you have no medical legal
They are even
problems.
exempted
Yes.
now.
Yes, they are exempted now. Even radiologists are getting into some trouble.
Yes,
If you don't want to get into any medical legal issues, go into non-clinical. So medical
yes.
legal issues is a part and parcel of every doctor. You should be ready with that. You should put an indemnity for 1 crore with yourself. Indemnity insurance should be there. Everything is expected for any specialty, not only for surgical side. It is more in physical, medical side, to be frank. That's what I feel, madam. Medical legal issues, definitely physicians and surgeons are at risk, but
But I
we
think
are at less risk
slightly more
compared to.
with the OGIans, I think,
Yes,
sir.
OGN is
Comparing
more.
surgery and OG.
Madam, last 1 month back, we had a patient here. Patient was just undergoing lab sterilization. Patient died on table. Who will you tell the mistake is? The mistake is actually not by the OGN, it is by the anesthetist. But who is blamed here? Only the name of the OGN comes out here. Nobody knows the anesthetist. It's an anesthesia complication, but nobody knows. But problem is, once you document this, there is a risk of anesthesia related complication during surgery. If the OGN has documented already, this is not a problem, because no one knows which complication can happen to whom at any point of time. So we have to document everything, madam. That is the most important thing. See, but definitely that gynecologist is not going to go face the problem, because the gynecologist has already got a clear-cut concern. There is anesthesia complication risks are there. And during laparoscopic sterilization, this complication can happen. So this has happened. This is very common. You would have also heard so many small procedures going for complication is very dangerous. That is why in surgical field, many surgeons prefer to become oncosurgeons. So oncosurgery is a field already patients are already mostly they're prepared towards terminal stage. So most of the surgeons oncosurgery, I can say many surgical specialty are less stressful compared to OBG or other specialties. That is part and parcel of our practice. No other way.
So on a lighter note, sir, over all these years as a surgeon, have you ever regretted taking or like thought back about surgery at any point?
No. To be frank, we always regret at some point of time when some of our patients gets complicated. So every year, at least 1 or 2 patients of our patients, especially super specialty practice, 1 or 2 patients used to die. We cannot, for example, we do an anastomosis perfectly. That anastomosis gets leaked, and definitely that morbidity is going to make us sleepless. For example, last month I had a gastrectomy. Patient had a duodenal stump load, delayed duodenal stump load, and that started leaking, and we reopened and sutured. But that re-sutured, again it started leaking because of the malnourishment and hypoalbuminemia. But patient has to be in ventilator and ICU for around 20 days. Those 20 days are stressful for me also. I will be more stressed what to do. This patient will he survive or not? We have to do TP and everything we are doing. But that time now, what sometimes feel, why should we get so much stress? Finally, I'm going to get a surgeon fees of 50,000 rupees. For 50,000 rupees, should we get so much stressed? That stress is definitely more difficult for us. That is the most difficult for surgeons. But surgeons should accept this. Every year, once or a while, we will be getting this type of complications. We should be ready to face this type of complications, and we should get a proper consent. That is the most important thing. We should explain every possible complication. But you see that patient expired, but finally the patient expired after 20 days. But attenders, they know everything, because I have told this complication. I write it in bold letter. This is the first complication. I'll tell them. Duodenal stump load is inevitable. 5 to 10% of them will develop. And of that 5 to 10% will die. So this is an inevitable complication. So that patient expired. But whatever it is, we have to be sleepless and restless for 15 to 20 days. That is a major issue. That time we used to sometimes feel, so we should have not taken surgery. We should have taken medicine or radiology. You can relax and do the practice. No need to stress this much, too much. Like that we used to feel. Yeah, madam. You have felt somewhere like that? Only the complications will make us feel like that, but once we have a complication, that will make us feel like this.
Definitely. I think always there is that road not taken, I think, sir. Always that would be there. Once the complication happens, definitely, sir. And apart from this, I think once the residency becomes too tough, when you have the sleepless nights, foodless days, all those things are there, maybe at some point we feel that also was there, sir. But I think in the long run, when we look at the bigger picture, because I see a lot of dropouts during the residency as well, sir. When initially the first year is very tough, students tend to drop out thinking that there is going to be something better. But initially, maybe each and every branch has its pros and cons. You have to stick on and you have to push yourself, I think, rather than simply dropping, because maybe at some other time there will be difficulty for someone else. Just an example, when I was in my first year residency, the residency was very tough for OGIans as such, but it was very light for anesthesia. So one of my friend actually just dropped from this gynae and she joined anesthesia. But by the time we are third year OBG was easy. We were able to study, we were able to do surgeries, but anesthesia was really tight. They were having continuous studies and everything. So in the short term, don't just have a look at few days and don't drop the branch. Have a bigger picture, stay on as much as possible. Finally, it's going to be worth it. It's coming from someone who actually felt like dropping in the first year because it was so tough. But finally, I'm so grateful I didn't do it at that point of time.
Nice, madam. Nice. Nice talking, madam. Let us see some questions from the students, madam. One student is asking about ortho and surgery. Dr. Piyush Khatri, we will be discussing soon about ortho and surgery. Day after tomorrow, we have a session. You can join that session. Ma'am has answered your question, Piyush. Ma'am, how would be my OBG for males if you have answered? And Dr. Karthik Kumar is asking about ENT related to super specialty. Karthik Kumar, we'll be conducting another session, but ENT people are eligible for head and neck onco surgery as of now. So neurosurgery, plastic surgery, you know very well, every year they're changing. So this year, once the prospectus comes only, we will get an idea whether you are eligible for neurosurgery or plastic surgery. But I think you can keep preparing for neurosurgery. Usually they give ENT surgeons eligible for neurosurgery. You can keep preparing. These are the questions from the students, madam. Do you want to tell anything, madam, finally to the students who are about to take gynec and settle?
So whatever be the branch they're going to choose, I think this is one thing that is for your life. It's a signature for your life. So choose very carefully, weigh all your pros and cons. Well, every branch has its own pros and cons. I can't even point out one branch which only has pros. Everything has its own pros and cons. Decide as for you. Suppose you are someone who cannot like get up at night, who cannot take any emergency call. Maybe OBG might not be a good fit for you. Maybe someone you can deal with these things. Like it depends all upon you. I know that it's like a rivalry or a war between the subject surgery versus OBG, but actually it's not a war between surgery, OBG or anything. It's all about you, what you want, what are the things that you matter for you. Maybe you are someone who likes a lot of free time, work-life balance, who likes a 9 to 4 job. In that case, maybe surgery or even OBG might not be the right fit for you. So the thing is, you weigh all your pros and cons and take a very good informed decision, because this is going to be for your life. And please don't be influenced by anyone else. They are not going to be in this field for you in the long term. Let it be your parents, let it be your partner, your mother-in-law, whatever, whoever. No one should decide for you. It should be your own decision. Sit alone, write all your pros and cons, which branch you want, and decide for yourself. Let it not be affected by anyone else.
It's correct, madam. That is absolutely correct. And I will only say only one thing for selecting surgery, that is take surgery only if you have patient. Otherwise, don't take. Otherwise, don't take. There are so many other fields and ready to face many. You have to take a long-term settlement, that is indefinitely. You can sometimes people I have seen settle at 45 years also. But once you settle, you have an extraordinary income. Whatever you lost in the past 10 years, you will get that income definitely. So don't worry about income. So don't take general surgery only thinking income in your mind. If you want income more, you take OBG only. OBG is better for income compared to surgery. And many girls might have a query whether I can take OBG or surgery. So as madam told, if you're ready to face stress, sleepless nights, you can take OBG. Or always you can take MS general surgery, and you can do all the surgeries. Even gynec surgeries are done by many MS general surgeons, and they have OG is not only is now called as MSOG. Previously it is MDOG. It is because OBG is a department combining medicine with surgery. But surgery is pure surgery, so you can always do all the surgeries done by obstetricians except LSES, hysterectomy, oophorectomy, everything is done by general surgeons everywhere. So you can always take general surgery if you have an interest towards surgery without taking OBG. But general surgery is little stress less compared to OBG, as madam told. Here we are not going to have two life. We are only going to deal one life. And especially if you are going to have a gynec practice, except only one complication, ureteric injury, there is no other complication. So you can manage ureteric injury. As days goes on, you will never have any ureteric injury also. So always you can take general surgery. Girls can take general surgery, madam.
Exactly. Sir, if we divide it in a simple way, I think if you are interested in surgical branch, you have a lot of patients, you are ready to wait for long term and invest in your skills, then go for surgery. If you want to settle down fast, you want a shorter field, which is there, and of course deal with all the emergency, and you're ready to cope up with the stress as well, maybe OBG might be the right
OBG
fit.
might be the better. Yeah, madam.
Good surgery.
Thank you, madam. Thank you so much for thank you for the session. I think there are no more queries from the student side, madam. I think if you students, if you have any queries, you can post in the chat box. We will be following this chat box and we will rectify your query in this chat box. Thank you for this session, madam. Thank you so much.
Thank you, sir.
Thank you, ma'am. Thank you. Thank you. Stop live. Yes.
Yes, sir. We have stopped.
Okay, thank you. Thank you, Vinod. Thank you.
Thank you, sir. Bye.